I am Pavni Panya, your anchor for today's episode, and you're watching #Hair on Air podcast series. We all love our hair, and we know that it is the reason behind our confidence, our good looks, and our beauty. But a lot of people these days face a lot of hair loss problems, hair fall problems, which makes them follow many various kinds of remedies, use chemicals and cheap products even. That even makes them follow and trust blindly these so-called influencers who talk about products which are not that good for your hair and can damage your hair in the long run. That is why we bring with us our podcast #Hair on Air series so that you can connect with real experts and get real knowledge on what your hair needs from the inside out. And likewise, we have with us today a renowned dermatologist and trichologist from Delhi. We have Dr. Pankaj Chaturvedi. We're so glad to have you, sir, on our podcast.
Thank you.
Okay. So, sir, before we dive into the whole podcast and get to know how we can repair our hair and manage our hair to keep them beautiful and shining, we would love to know from you a little bit about yourself and how you got into the whole dermatology and trichology thing.
So dermatology is one of the very fascinating branch. When I was doing my MBBS, I was always attracted towards the art and the aesthetics. And after clearing my PG, I got a very good rank. And that point of time, dermatology was one of the top trending branches globally. Of course, it wasn't that great in India at that point of time. But my friends who were in Americas and Europe, they told me that that's number one branch is dermatology. So I took that. And this is how I entered dermatology. Now, dermatology is all about skin, hair, and nails. So when you are studying, you see skin cases, you see hair cases, you see nail cases. And this is how you develop your interest towards a particular specialty. After clearing my MD, I became attracted towards aesthetics and the trichology. So currently we have one of the most comprehensive and successful practice around skin and hair, aesthetics and trichology.
That is lovely to hear, Dr. Pankaj. So would you like to share with us any memorable case or anything from your such a long period of experience? And please tell us, how long has it been in the field for you?
Precisely, it has been 13 years now in practice and 14th years of my dermatology practice. And there have been many cases which were so interesting and not that straightforward. Trichology is a field which keeps on giving you surprises. It's not a branch where you see the walking straightforward diagnosis every day. There are many cases which come out to be something completely different. What do you think? So I remember one of the case in 2015. There was a patient who was taking treatment for male pattern baldness, and he was taking finasteride and applying minoxidil, taking all the nutrients, and taking PRPs, and the response was suboptimal. When I saw that case, at first glance, it appeared to be male pattern baldness to me. But somehow I found that history-wise, after taking all medications which are supposed to be the best ones, there was no response. So I had a close examination. And then I found the case was not male pattern baldness. It was a case of diffuse alopecia areata. Okay. So I did a tissue biopsy, scalp biopsy, and the biopsy proven that. As per my suspicion, we treated that patient with a few immunosuppressive medications and topicals. And in 4 months of time, the patient was transformed completely. Wow. So this is how correct diagnosis and correct approach, that's very important. Many times the diseases, they look a little different than what actually they are. So not every case is a book picture. Many times it looks something different and it comes out to be something different.
That is lovely to hear, Dr. Pankaj. And for you, it might be just one memorable case, but I am sure that for the patient, it must have been life-changing and just gaining all the confidence back. And that is why we're so thankful to doctors like you. And moving on to the podcast now, we would like to ask you lots of questions regarding hair and everything. So our very first question is going to be that have the cases of hair fall and hair loss increased with time, or have people just become very much more conscious these days about hair fall?
I'll say both.
Okay.
So as we are getting more and more conscious about the looks, people are more worried about their looks. They're more careful about their looks. Of course, even if they have 5 strands falling a day, they come to the clinic seeking the medical advice. The doctor, look at me, I'm losing 5 strands a day. So, of course, they're more watchful, they're more focused about the self-grooming, etc. But at the same point of time, the life was not that stressful a few years back. So the stress is increasing, pollution is increasing. If you see whatever we are eating is not that pure. Most of things are adulterated. And because of that, we are seeing over the period of time, the incidence of hair diseases and the baldness is increasing. Also, there are certain unknown factors. If we see male pattern hair loss, which is known to be a genetic condition, you'll clearly see a difference in the age of onset of the male pattern baldness in the father and the son. You'll always find that in the younger generation, the male pattern baldness runs roughly 10 to 15 years in advance. So father will say, no, at the age of 35, I was having very good hair. But look at you, you're 20 and you are half bald.
Okay.
So we know that the younger generations, they are having early onset and the faster progression when it comes to male pattern baldness. And also the common conditions, which are like a telogen, effluvium, etc., they're also more common these days rather than what they used to be earlier.
Okay. So Dr. Pankaj, these days, like you said, people are very much careful about their aesthetics and they want to look very nice and about all their hair and all these hair styling, hair caring and grooming products that are there in the market available. So what do you say, is it safe to use, or do the people who are buying such products, should they check some agent or some composition while buying that product?
Absolutely. There should be a balanced approach. Apparently, if the styling grooming products are used in moderation, they do not have major issues. But the problem is overstyling, using something which causes too much of product buildup, using something which damages the texture of the hair, damages the cuticle of the hair. Of course, in the long run, it causes deterioration in the quality of the hair and may also causes issues in the scalp. For example, people who are using lots and lots of oil, they'll end up getting seborrheic dermatitis, leading to greasy scalp, sometimes flaky scalp, itching, and if not treated, it may trigger the hair fall in the long run. Also, those patients who are using a lot of wax or a lot of hair styling products, they often come and they say, whenever I scratch my head, there's a lot of scaly stuff coming out. That happens because of product buildup. Many gels which are used, they cause dryness of the hair, and many times the hair become very brittle and frizzy. It's difficult to style them otherwise. So we have to be a little careful when we are choosing the styling products and grooming products. Also the shampoos, we should be careful, shouldn't go for shampoos which have detergents in them, or shampoos that are having sulfates, etc. So these are common things which we have to follow. In general, they're not bad, but we should use them in moderation, not extensively.
Definitely, doctor. Everything is good in moderation, and that is for sure.
Yes.
So, Dr. Pankaj, like we said, we just talked about hair loss and hair fall. But apart from this, one very common problem that a lot of people face is hair graying. And that is very natural yet common. But a lot of our viewers would love to know, can that actually be prevented? And if yes, please let us know.
Okay, very interesting question. Many of my patients, they ask the same question. Premature graying is usually, there are two major reasons. In majority of the cases, the premature graying happens because of the genetic structure and because of the unknown factors. In less than 10% people, the premature graying happens because of certain nutritional deficiencies. So if you ask, can we stop the premature graying or can we revert the hair back to gray? My answer is, in most of the cases, no. But yes, we give therapeutic trial of certain nutrients to few of the patients. And if premature graying is because of the nutritional deficiencies, we see that the graying slows down.
Okay.
They may not turn back to black, but we can see that the progression of the graying has gone down. But in majority of the cases, the outcome is very frustrating because, as I said, majority of the cases are because of the genetics and certain unknown factors, and there is no outcome of any kind of treatment in these patients. There's a futile exercise to treat them.
Okay, so there's definitely no way to stop or prevent hair from graying. It will definitely happen.
In very few cases, yes, we can, but in majority of the cases, we cannot.
Oh, okay.
Yeah. And when it comes to the hair color, all the hair colors, like any of the hair color can be used. There's a misconception that, okay, if you use henna, it's beneficial. And if you're going for a chemical dye or any chemical color, it's bad for your hair. That's not correct. Roughly 1% people, they are allergic to a chemical called as PPD, paraphenyl diamine, which is the key ingredient of any kind of hair color. If somebody is allergic to this particular ingredient, they develop rashes and eventually they become allergic to that hair color. Remaining 99% people, they do absolutely fine when they're using these hair color. Also, many people think that after using these hair color, the hair become less, the hair fall is there, the hair become thin. That is not correct because the penetration of the hair color is not that deep. It can never reach at the level of the root where the actual growth activity is there in the hair follicle. So it's a misconception. So aesthetically, of course, these chemical-based hair color, they give a better look. Yes, it sounds very interesting that you're using an organic hair color or something which is a plant-based hair color like henna. But otherwise, if somebody is not allergic, I don't find any advantage in using a completely plant-based hair color in comparison to any kind of the normal hair dye.
Okay, so given to that, only people who are coloring their hair to hide the grays and to color their hair. So how often should they do that?
So it depends. Once in a month is fairly good frequency, but many people, they have it. It all depends what kind of rate of growth a person is having. Somebody is having a rapid growth. After 15 days, they may see that the roots are gray. So they may require a touch-up. So it doesn't matter actually.
So Dr. Pankaj, my next question is going to be a little bit more technical and I would want you to tell our audience so that they know finally. So what is exactly traction alopecia?
Traction alopecia is a type of scarring alopecia where the hair loss happens because of a constant mechanical pull to the hair. Now, this kind of traction alopecia, can be seen in our Sikh community because they have to wear a tight turban, and to keep all the hair tucked in, they have to tie it very hard. And because of that, we see many of the Sikhs, they lose hair from the sides, especially from the temporal area. Second type of patients are those patients who make a very tight pony. So in them, we see a recession of the hairline from the front area. Many of the young girls, as young as 14, 15, we see that there is a hair loss from this area because of that tight pony.
Yes.
And third group of the patients who have a compulsive desire to pull the hair, which is called as trichotillomania. So this is a disease where there's a lot of stress and anxiety, and that anxiety gets alleviated when patient pulls the hair. So because of that compulsive desire, they keep on plucking their hair out of anxiety and they lose hair from one particular part of the scalp. So in majority of the cases, if this is diagnosed a little early, we can further slow down the progression by treating that underlying anxiety or stress. In other patients who are wearing a tight pony or tight turban, we can tell them to loosen up a little. But if it is not treated on time, the majority of the cases develop micro scarring in that area, and there is no outcome of any kind of medical treatment in that. Later, we can do a hair restoration or hair transplant in that area, but medically they cannot be grown back because there's permanent damage to the root because of that inflammation which happens because of this constant pull.
Oh, that is definitely some new information for me and the viewers as well.
Yeah.
So now I would like to hop on a few myths Like we talked about in the beginning, that these days people are so influenced by these influencers on social media, Instagram and everything. So people are promoting lots of things. So we as audience, we are not sure if that's a myth or a reality. And you being an expert doctor, so we would love to bust a few myths from you. So the very first myth that I want you to bust is that does dandruff causes hair graying and hair loss?
Okay. Not very easy to answer.
Okay.
General answer is no. The dandruff does not cause hair graying or hair loss. But yes, if the dandruff is chronic and severe, and if it is not treated for years and years, because of that chronic inflammation, it may cause damage to their roots. Because of inflammation, it may cause hair fall, but it doesn't cause any kind of graying. Graying has nothing to do with the dandruff.
Okay.
Yeah.
So our next myth is that does trimming our hair make it grow faster?
This is a misconception. Shaving the hair or cutting the hair frequently does not make them grow faster. This is the biggest misconception. Now, this practice is being followed in our Indian culture, that in the childhood, early childhood, after the birth, when we see that there are not enough hair, they keep on shaving the hair again and again. So hair do not come because of that shaving. Hair come because of the time which we get in that process. It's because of time. It's not because of shaving. Same thing happens when we do laser hair reduction for females. They say, doctor, I got facial hair because I shaved it once. Mm-hmm. And then I tell them, it's not because you shaved it once, it's because of the hormones. Whether you shave it or you do not shave it, the growth comes because of the hormonal impact of the roots. So misconception.
The next myth that I want you to enlighten us with, that what is it actually? So does brushing our hair a lot of times in the whole day, does it make our hair weak or it causes more hair fall?
Answer is no. Brushing only, like whenever you're brushing, we have got telogen hair, the hair which are already sticking on the surface to fall. Only those hair come out when you're brushing your hair, no matter how many times you're doing in a day. Provided you do not have extremely frizzy hair and you're not too rough in your brushing. If your hair are frizzy and you're very rough in brushing your hair, then in fact you can pull the normal healthy hair also out. And so if you are having pain while brushing your hair, that means you're also plucking the anagen hair. So be gentle, use a nice brush, and make sure that your hair are not too frizzy before brushing, so you'll be fine.
Okay. And the last myth I want you to bust is that does using hot water while washing your hair, is it good for our hair or does it cause some problem?
It's neither good for hair, not bad for the hair. The only thing which we have seen, people who are addicted to very hot water for their shampooing or cleaning or taking a shower, they develop more chances of they more frequently develop seborrheic dermatitis in comparison to those people who are taking shower with normal water or water which is not too hot, lukewarm, or a cold water. So extremely hot water, like a too hot water, very frequently leads to seborrheic dermatitis or dandruff. That's the only thing. Otherwise, no major harm.
Okay. So I would like to ask you next, Dr. Pankaj, that apart from the graying of hair, there are many other symptoms that why people are losing their hair. There are in different intensities. So what exactly should be the solution that they should be recommended or they should be going for? Because there's so many solutions in the market, given therapies and hair nutrient therapies and transplants and everything. So what exactly one should do while facing the hair loss problems?
Right. I believe there should be the proper diagnosis. Okay. That is the core of any kind of treatment of the hair loss. Once the diagnosis is made, then we have to specifically treat that problem. For example, if a person is having telogen effluvium, or you can say disturbance of the hair cycle because of that person is losing the hair, the treatment approach is completely different from a person who's having hair loss because of alopecia areata, or a person who's having a male pattern hair loss. PRPs, etc., they're supplementary treatments. They're not specific solutions, and they only help when the person is taking a specific treatment. For example, somebody who's having a male pattern baldness, we have to give that person minoxidil or finasteride after proper assessment. And on the top of that, if a person wants to go for nutritional therapy or a person wants to go for PRP therapies, there will be a little bit of added advantage. But you cannot treat alopecia, male pattern baldness just with the PRPs or supplements, or alopecia areata with supplements and PRP therapies without a specific treatment. So proper diagnosis, correct and specific treatment is the core of any kind of treatment of hair fall or hair disorders.
So it overall boils down to coming to the expert and knowing from them what is best for us instead of just anticipating and deciding ourselves.
Yes, in this entire process, many times I've seen that people who could have been treated efficiently initially, they ended up wasting that golden period of a few months just by Googling and surfing the internet and taking the hair care from Instagram and other friendly recommendations. So it's important to treat a condition on a timely basis. For example, I saw a case of lichen planopilaris, which is a type of scarring alopecia of the scalp. This condition is known to be rapidly progressive. It starts and eats up the hair follicles permanently and damages. So as the disease progresses, the chances of regrowth are negligible. And there are patches which are completely patches of scarring alopecia. Now, in this condition, the correct diagnosis at correct time is very important. So that patient kept on listening to the neighbors and uncles and started using home remedies and certain types of oil. Initially, when he showed me the picture, the doctor, this is how it started. And after 3 months, the half of the 50% of the hair were gone. And people kept on telling him that go to a doctor and see what treatment should be started. But he was misguided. And we know that in this condition, we cannot regrow the hair. We can only stop it. Okay. So by the time we started medications and stopped it, the 50% damage was done. Oh. So that's why it's very important if you're losing hair, you should see a dermatologist, get the correct diagnosis. You should know why you're losing hair and what's the approach, what's the roadmap of the treatment.
Dr. Pankaj, my last question to you is that talking about hair transplant itself, slowly and steadily people are going forward to it and they are becoming comfortable with it, but it still hasn't gained that much popularity that it can be considered as mainstream. So why do you think that is like, and where do you see the future?
India is a very traditional country. When it comes to treatments, we are very modern in accepting the changes. But when it comes to accept the changes in the healthcare, we go on a back foot. We want to see how it is going, whether my friends has got it done, my family members have got it done or not. And then only we think of, getting something done. So main reason I think is lack of awareness. They still think this is a procedure which is extremely painful or risky, which it is not. It's very advanced technology. Pain part is minimal. Recovery is very fast. But there are myths. So people get scared that it may cause extreme pain. They may get scarring. They may get infection. It can be life-threatening. So because of these reasons, people are not able to gather the courage and they do not come forwards for the hair transplant. But I think time is changing. And as more and more people, especially youngsters, are opting for the procedure, their friends and the people in the circle, now they realize that how easy it was. So we are seeing exponential growth of these procedures. People are more open and more keen to know more about the hair transplant, to learn more about it, and they're undergoing the procedures. But I've seen that paradigm shift in last 5 years, when people used to be very scared. They used to hide things from their family that I'm going for this procedure. Now I see youngsters coming on their own, taking a decision without any interference from the family, or sometimes I just get a call from their parents that, okay, Dr. Hope, everything is fine. I said, yeah, it's okay, absolutely fine. But 5 years back, this was a major decision. I used to 5-6 people sitting around me, an entire family is there, and they're asking questions. Dr. Hope, it is not risky. Hope there's no life-threatening issue. So time is changing, and I think the future is very bright because in India, this condition is very, very common.
So, Dr. Pankaj, that was a very insightful conversation that we just had right now. So, any last message or any suggestion any final words that you would like our viewers to know to take care of their hair and everything?
So, I will tell you 3 things. 1, eat healthy. Majority of the cases where people lose hair are because of nutritional deficiencies. So, generic hair fall which is happening, most probably it is because of nutritional deficiencies. Number 2, improve cleaning habits. Do proper shampooing, alternate days, be tough in cleaning so that you can clean all the dirt on and the extra oil which is there in the scalp. And third, if you are having any kind of hair issue, hair shedding, hair fall, or patches, do not get scared. Seek an opinion from a qualified dermatologist so that it can be diagnosed and treated on time. Thank you.
Okay, that was lovely. It was lovely having you on our podcast, #Hair on Air series. Thank you so much, Dr. Pankaj.
Welcome.
Thank you so much to our viewers for being such a lovely audience. Similarly, if you want to maintain good hair and you want to repair your damage and you want to learn more about your hair, stay connected with us on our #Hair on Air podcast series. We are available on YouTube, Spotify, Instagram, and on Apple Podcast as well. See you on our next episode with a new expert. Thank you.